Welcome back, everyone. We're talking a little bit about speech and language today. To do that for us, Jessie Lee is with us. She's a speech and language pathologist. To her left there, Dr. Kendra Recker is on her left. She's an audiologist, both with Lima Memorial Health System. You guys keep busy because you handle so many different things. Give us a sense, if you could, some of the issues you deal with and some of the biggest issues in that area that we might face every day.
So I deal with the hearing. With hearing, we have, hearing loss, whether that's in adults, whether it's kind of from aging, from genetics, or just from noise exposure. We start to see patients who say, well, I can hear a conversation, but I can't quite understand, what's going on. Gets a lot more difficult when there's noise. And on the other hand, we have kiddos who might be diagnosed at birth, or we kind of lose track of them. They have a progressive hearing loss throughout their childhood. That can make it really difficult to start to learn and develop speech and language if they're not hearing it properly. So you want to talk more about that?
Yeah, and that's kind of where we take over. Speech language pathology is kind of broad, and that we see patients from birth to the end of life. And we'll see patients referred from Kendra for those hearing issues that they've now delayed in their speech and language development. And so we kind of see the same things, those delays in developing how they are expressing themselves or understanding language, the way their speech sounds. It might be a little bit slurred or distorted. We see adults that have aphasia after some sort of neurologic event or difficulty swallowing. Interesting enough, here at the hospital, we've had a couple therapists get trained in the SOS feeding approach. And so now we do pediatric dysphagia and feeding here. So we kind of have a lot of different hands in different pots, and we do a lot here at the hospital.
Yeah, I can imagine. I'm glad you guys explained how closely your jobs are intertwined, because Dr. Recker, you were talking about if there's hearing problems. Let's talk a little bit about the treatment aspect. Do you have to get to the root, I guess, of what's causing it first before you can come up with that treatment plan?
Right. So whether the hearing loss is from fluid behind the ears, if they have recurrent ear infections, we start to see those kiddos that just aren't talking. They're 2 years old, don't have any kind of expressive language because it's typically like you're hearing underwater. So that fluid in there, to get rid of that, we have to go kind of send them to an ENT to get that taken care of. What else? Or if it's more of a permanent hearing loss, do we fit them with hearing aids? And then we send them over to speech therapy so they can start to develop these different sounds.
Yeah, Jessica, I think of your role too. You talked about, kids that will have speech and language issues from birth, and then they're trying to develop that. And then you also deal with patients who maybe had some kind of catastrophic event, whether it's a stroke or something like that. Is there a different approach then, depending on how that patient comes in?
Yeah, we always start with an evaluation, and that kind of helps us individualize what needs they have. And then at that point, we can develop a treatment plan to better address those needs. So each person that comes in will have different goals, and we'll address it in different ways. And we try to keep in mind their background. So if it's a kid that has a lot of siblings, we want to base our treatment around interacting with other kids and how they communicate with their family. Whereas with an adult, we want to base that treatment on, are they still working? How do we get you back to work and communicating and understanding things the way you did before? Or, interacting with your grandchildren. We want to address everything individually. So that will affect how we do things. And then once we come up with those plans, we initiate treatment and we get going.
Move on from there. Dr. Recker, if someone hears us today and they know of someone, or they themselves have speech, language, hearing issues, what's the first step to get a hold of you guys and start getting that treatment?
Yeah, so the first step is just going to your primary care physician and just kind of expressing your concerns with them. At that point, they'll send over an order or referral to our office, once our office gets that referral, we'll reach out to you to get that scheduled, get you kind of on the schedule to come in. Or if you have any questions, you can give us a call. Our number is 419-226-5070.
Okay, that's where the help starts. Thank you, ladies. We appreciate it.
Yeah, thanks for having us.
You bet. Nice chatting with you. We'll be back after this.